Why is our healthcare system so in trouble? We don't want handouts, right? We don't want, because we're not going to get a handout, frankly. The federal government's not just going to go, Guam needs a hospital and give us $1 billion. It's not going to happen. We need incentives where we can give significant tax breaks to the private sector so that it could encourage them to bring in private sector capital. And then we need to get rid of those Medicaid caps, put in not only tax incentives, but business incentives to bring in the private sector that can actually finance new hospital construction. But we've got to find the money for it. That's one of the toughest pieces. And then we've got to have the people, because what good is a building? That's not healthcare. The healthcare comes from doctors like you. If we don't have the doctors, we're not going to have the healthcare for the people on Guam. And we can't always rely on sending people to, the Philippines to be able to get healthcare. I mean, what are you saying about America if America's foremost soil in the Asia Pacific has healthcare that's so inadequate that we have to send people to Asia to actually get advanced medical care, or to Hawaii? I mean, it's not the right plan, and it's not a good demonstration of the strength of America in Asia. And I think if we make that argument and we work on incentives, we bring in the private sector, we increase housing stock, we increase hospitals, we bring up the level of salaries on Guam, which will encourage people to want to come here to work. We bring home, you know how many Chamorros get certified in all sorts of medical professions and then leave? We need to bring back more of Guam's own to be able to build out a healthcare system that the people of Guam deserve. But the only way we can do that is if we pay them what they deserve. We have a quality of life that's worth living. They're able to afford homes. They're able to access things on the island and have good lives for their families, a good education system for their children. It all kind of goes hand in hand. And all at the end of the day, it comes down to federal policies.